Is it cool? Cool. Wait, inside the rock. She'll tell me that.
Mommy. Mommy.
She'll say that. So cool now.
I like my water.
Okay.
What did you carry to the but you did not put. Just leave the house. Just leave the house. I don't know. You come back here. Very fine. Put your notice and stick one first.
Hi, coach. How to go?
Good evening, everyone. Can you all hear me? Can please someone confirm that they can hear me?
Good evening, sir.
Someone please confirm if you can hear me.
Good evening, I can hear you, sir.
Okay. Do we have people in this class? Please, someone confirm that you can hear me. All right, we'll be starting respective. Good evening, everyone. My name is Dennis Williams. Um, Good evening, everyone. My name is Dennis Williams, and I'll be your moderator for today. Welcome to the second week of our Health, Tech, and Law session for the JIIPCC Mentorship and Internship Program. Right, you all are welcome to today's class, and I trust that this session is going to be both wonderful and very, very interactive. So please, we should all pay attention and trust that um, everything is going to go on smoothly. Please, I'll kindly like to ask that our mentees turn on their videos so that we can see you all and know that we are interacting with people who are with us. So thank you once again for joining. You're welcome. So let's go straight into the business of today. Right, I'll be taking announcements. Right, announcements. So for our first announcements, registration for our next quarter of mentorship has officially begun. Right, so if you have friends and family or colleagues that you feel may be interested in the Gypsy Mentorship and Internship Program, you can kindly go ahead and let them know that our mentorship program, registration for our mentorship program is ongoing. Yes, even though we are just in the second week of this mentorship, I'm sure that there's still a lot for us to discover and to learn. And I'm sure with time, the course or the course contents will become more interesting. So please, you can let your colleagues, your family members, your friends know that the Gypsy Mentorship and Internship Program has started registration. Courses of or that are available for mentorship are intellectual property, artificial intelligence and technology, the energy industry, fintech industry, health tech and law. Our current course right now, patent drafting, blockchain, NFT and metaverse, data privacy and protection, entertainment, business and law, and alternative disputes resolution. So these are the courses that we'll be doing or will be running through for next quarter, right? So moving forward, I would like to introduce our mentor. I don't think he's yet with us, but I'm very sure he'll be joining us very shortly. Our mentor for today is the one and only, none other than Mr. Ebenezer Egwatu. Ebenezer Ebenezer C. Egwatu is a legal practitioner, medical law consultant, certified mediator, a trained legislative drafter, and a passionate patients' rights and safety advocate. He is a principal partner, Law Found Multidisciplinary Consult, a firm that provides innovative legal solutions located in Abuja, Federal Capital Territory, Nigeria. He is also the founder and executive director of Lawyers Arise for the People Initiative, LAPI, a patients' rights and safety advocacy NGO. Ebenezer is a trained medical care assessor by International Medical Law Center, St. Kitts, North America. He is a member of the Nigerian Bar Association, member Medical Law Professionals Association of Nigeria, member Institute of Medical and Health Law, member Bioethics Society of Nigeria, member Patient Safety Africa, member World Association for Medical Law, and member Association of Legislative Drafter and Advocacy Practitioners. He currently serves as the chairman, Health and Medical Law Committee, Nigerian Bar Association, Gariki Branch, Abuja, the Public Relations Officer, Institute of Medical and Health Law, and the legal team lead for Make Our Hospital Work campaign, a citizen-led community-based advocacy to improve the quality of healthcare services in hospitals and primary healthcare facilities across Nigeria. He trains doctors, nurses, and healthcare professionals on promoting patients' rights and avoiding medical negligence. He is an avid reader, a researcher, and loves to serve God by serving humanity. We want to say thank you to Mr. Ebenezer for always constantly being here and choosing to um, help mentor mentees and train them to become healthcare practitioners and just not just enthusiasts but know the nitty gritties of the healthcare industry. Thank you, Mr. Ebenezer, for constantly choosing to be a mentor on our program. You are very welcome, sir. I think Mr. Ebenezer is here with us on call. Thank you, sir, for joining in. And we'd just like to hear from you today. Our topic for today is healthcare fraud and abuse, medical malpractice, patients' rights, and evidence gathering. Mr. Ebenezer, if you can, please, we'd like to get an introduction from you before our mentees start their presentation. You're welcome, sir. Sir, we can't really hear you, sir. Hello, sir. Are you with us? It seems your audio is not coming out because I can see that you are unmuted. Hello, sir. Okay. It seems Mr. Ebenezer is still trying to connect his audio. I don't think he's able to hear us yet. So why don't we'll just like to go ahead and start with our presentation. So please, if it's possible, we'll just like to have our group presenters come up and make their presentation. Mr. Ebenezer is already with us, so we will just have his feedback, and we'll just be having both his feedback and his introduction into today's topic once the presentations are done. So, Group One presenter, um, Please, you can come up and make your presentation. I'll be helping with the sharing of slides. So please just unmute yourself so that we can start the presentation.
Okay. Hello, everybody. Good evening.
Good evening.
Please, can you share the slide now?
Daddy, baby. Yeah, please.
No, is there. There's there.
Hello, sir.
Ruben, can you hear us?
Okay. You- Hello.
Yes. Hello, Bridget. You have to make presentations for your group, right? So please, you can go ahead with your presentation.
Okay. Yes, somebody was supposed to share the slide, so I'm waiting for the slide. Sorry.
Yes. Okay, I'll be sharing the slides for you. Just go ahead and start.
Okay. So our topic for
Yes,
this
absolutely.
week was, sir?
Please, you can
Okay.
continue.
So our topic for this. Okay. So our topic for this week was healthcare fraud and abuse detection. So what is healthcare fraud? So healthcare fraud has to do with, according to a legal definition, is a crime in which healthcare claims are filed, dishonestly filed to proceed illegally from the payment received. So there are a lot of healthcare fraud that are happening currently in Nigeria that has to do with a lot of pensioners and all of that thing. So next slide, please. There are many types of healthcare fraud, including those carried out by healthcare practitioners and those committed by the healthcare insurance men. So prosecutions under this title are carried out under the Federal False Claims Act Examples are the billing fraud, and a common type of healthcare fraud involves the fraudulent billing practice by healthcare providers. For example, a healthcare provider might submit claims for services or procedures that were never performed, inflate the cost of services provided, or bill for services that are not medically necessary. This type of fraud can result in significant financial losses for healthcare. This type of fraud can result in significant financial losses, whereby a lot of people lose their money as a result of this healthcare fraud. It has cost most of the middle, should I say, the middle type of people money, pensioners, earlier death. So, because they increase the price of goods. There are even some hospitals that we go to these days, and it would be like, oh, this is the price of the drug, and actually it isn't, because they are just trying to get more gain. The next slide, please. So what are abuse detection methods? Medical abuse means that healthcare service providers offer unnecessary medical treatment or services to the patient to get more profit or kickback. So abuse detection is the task of identifying abusive behavior such as hate speech, offensive speech in the medical part. Abuse in healthcare is defined as practices that are inconsistent with accepted sound systems. Business or medical practices result in unnecessary costs or services that are not medically necessary or that fail to meet professionally recognized standards for healthcare. So abuse now, abuse is when people use positions that they were put in a particular positions, like pharmacist or a healthcare worker, or even the bank actually, whereby where you pay for healthcare insurance and you can't get your money back. And because they are in that position, they abuse it. So what are these techniques that we can use to detect these abuses? So techniques used for detection of abuse of healthcare fraud are data analysis and predictive modeling. That is the utilizing of advanced data with advanced techniques. It is modeling algorithms to identify patterns and anomalies in healthcare data by analyzing large volumes of claims data. Providers can detect unusual billing patterns or dispenses that may indicate fraudulent or abusive behavior. Now, this is actually like setting up systems, more like going into the computer base, and not that this is we are in an age where most of the things we do now are on a computer. So if I believe that when they can impute these more data systems in the hospital, whereby the government can regulate this kind of things, regulate the amount of billings and all of that, whereby receipts should be provided for every transaction that is made in the hospital, every transaction that is made in the bank should be submitted to the government, and whereby it is managed by people that can be trusted and not people that have been satisfied by data, that they use this data and find out, okay, where is it being overcharged? By who is it being overcharged? Who is overcharging? Yes, next slide, please. Next slide. Hello. Hello, I heard somebody can't hear me. Can you hear me? Hello, can you hear me?
Yes, we can.
Okay. Next slide, please. Okay, I think maybe he's having connection issues. So I'm going to try. Hello, Dennis. Mr. Dennis. Okay.
Yeah, I think Mr. Dennis cannot hear you right now, but you can go on with the presentation. Some of us are listening.
Yeah, sorry, I was logged out. Please, I will continue with the sharing. Thank you. Please continue.
Thank you.
Okay. 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 So the next one is claims on reviews and analysis. Now this one is by people that are set to analyze this data that were collected from the from the hospitals and the banks and all of that. Now, this is reviewing. There should be another set of people, another group of people that are analyzing the data that they have reviewed. Now, there should be another body that will review. That is further review. So conducting through reviews and analysis of healthcare claims to identify inconsistencies, errors, or suspicious billing practices. This can involve manual review by trained professionals or automated systems that flag potentially fraudulent claims for further investigation. Actually, for me, this part, I think it should be done by the automated systems because of the conditions that we find ourselves in right now, most especially in Nigeria and some other parts of the world. And the third one is provider and patient monitoring systems. This is implementing monitoring systems to track the behavior of healthcare providers and patients. This may include monitoring provider billing patterns, patient utilization of healthcare services, and prescription drug monitoring to identify potential cases of fraud or abuse. So this is, in essence, this is saying that catch them while they are young. That means the small errors, the small couple that is being pulled out, that is analyzing where can this happen, like the loops, the holes that in the system of the medical, the healthcare practice, and also in the banking system, the insurance system, the health system. And the other one is pattern recognition and anomaly detection, using advanced algorithms and machine learning techniques to identify pattern of fraudulent behavior and detect anomalies in healthcare data by analyzing historical data and identifying the deviations from normal behavior. The providers can flag potential fraudulent activities for further investigation. This is like what I earlier said, but this one now, the way they will find it is by going through their history. What have they been doing in the past month? What have they been doing in the past years? There are people that have been committing fraud for 10 years, for 5 years, for 16 years or more. So this is going back to the data that was before, and not just the data that is being presented at the moment, but ones that some of them that have been going on for years or longer time. With algorithms, like with machine learning, with techniques that involve computers. So the other one is by employing this detection. Okay, so in summary, by employing these detection techniques and implementing proactive measures, healthcare organizations can effectively prevent fraud. Now, moving to the second subtopic, which is medical malpractice trends. So, medical malpractice in Nigeria has been a long-standing issue with several notable trends. And Examples are challenges that involve the healthcare system. Some examples are misdiagnosis and delayed diagnosis. That is, lazy workers, lazy systems, or systems that slow down because they are manually handled. That is what it is saying. And these are putting people that are not qualified for the task to actually investigate this thing, whereby connections are used because the person does know somebody and knows somebody, they get the job, and they don't really know what this job entails. They don't really know what they are supposed to be doing. So they give wrong diagnosis, or maybe a set of medical practitioners that we've heard of, doctors that slept and all of that, other stuff, and they misdiagnose patients. So this is what some of the medical malpractice trends. So I'm going to read through. It says medical misdiagnosis or delayed diagnosis is a prevalent form of medical malpractice in Nigeria. In many cases, outcome. A patient presenting with symptoms of a serious illness, such as cancer, may be misdiagnosed with a less severe condition, resulting in delayed treatment and progression of the disease. So the next one is surgical errors. Surgical errors including wrong site surgery, improper anesthesia administration, or post-operative complications are another significant concern. Instances of surgeons performing the wrong procedure or operating on the wrong body part have been reported, leading to severe consequences for patients. Lack of adherence to safety protocol and inadequate training contributes to such errors. Yeah, this point actually got me really tense because there's a lot of stories that we hear about this, not just in Nigeria actually, but in some parts of the world, whereby you hear that soldiers, because they feel that, oh, they have experience of 10 years or 15 years. Yes, we know that experience is good, but there are times where they become too overconfident that they lead them to make mistakes. And these mistakes are covered up. That is where malpractice gets involved, where they find ways and falsify records and all of that stuff. The next point is inadequate facilities and equipment. So Nigerian healthcare infrastructure often lacks essential facilities, equipment, and resources, which can contribute to medical errors and malpractice. Hospitals may lack basic supplies, diagnostic tools, and functioning medical equipment, leading to substandard care and compromised patient safety. For example, the absence of reliable power sources in some healthcare facilities can hinder critical medical procedure and patient care. Inadequate facilities and equipment actually is something that we've been suffering for a long time in Nigeria and in some parts of Africa. In fact, whereby you see equipment, but they break down and they don't get fixed. Whereby you see that these things are missing and they try to improvise and find other means, but those means aren't really good because they are not supposed to be the tools that are used for that particular procedure. And this now causes a lot of mistakes. This now risks life of patients. This causes a lot of deaths in hospitals, whereby you go to a hospital and you feel, oh God, I'm going to be healed. I'm going to be free from this disease. And you go there and you just try to improvise one thing or the other, and the patient ends up dying because there are inadequate facilities and equipment. The next point is negligence and poor quality of care. So cases of negligence and substandard care by healthcare professionals are always prevalent. This includes instances of healthcare providers failing to adhere to standard treatment protocols, not providing adequate monitoring and follow-up care, and displaying unprofessional conduct. Patients may suffer harm due to incompetence or indifference of healthcare practitioners. This negligence and poor quality of care Actually, there are times whereby this is as a result of low staff in the hospital, is also as a result of nonchalant, no passion for their job, whereby they just leave a patient and maybe something happens whereby the surgery has some complications, and because of negligence, they don't notice and the patient ends up dying or gets stroke or one thing or the other. Another point is the overall addressing the underlying issues contributing to medical malpractice in Nigeria requires comprehensive reforms aimed at improving healthcare infrastructure, enhancing professional standards, and ensuring accountability within the healthcare system. Now, prevention of medical malpractice fraud involves several strategies, such as education and training. So ensuring healthcare professionals understand their ethical and legal obligation can help prevent fraudulent activity. Education and training. Make sure that the schools that these healthcare personnel go to have the right equipment. The foundation of a team matters a lot. Whereby you train a doctor in a place whereby they are already supplementing things. So when they get to the hospital, they are already used to that system of supplementing, and thereby they make mistakes. So there should be quality training in which there's adequate material, in which they understand what they are doing, in which you make them find passion in what they're doing, the good of what they're doing. Another one is the transparent communication, that is encouraging open and honest communication between patients and healthcare providers can reduce misunderstandings and potential fraudulent claims. That is patient to doctor's communication. You have to be open, you have to be honest. When a surgery has 50% of success, you tell the patient, don't tell the person that it is 90% when it is 50%. Don't say it is 100% when it's just 80%. That 20% matters a lot. And the person needs to be aware of the risk so that it wouldn't cause misunderstanding. It wouldn't ruin the name of the medical practitioner, of the practice. And in the next point is documentation. That is accurate and detailed documentation of medical procedures, diagnosis, and treatment can help defend against false claims. That means you doctors protect yourself. Record everything. If it is possible to record surgery, let it be done. So that when such claims happen, another thing is that during the consultation sessions, there should be a kind of record or a second personnel who records during conversation to know that, okay, I told you that this is 80% success rate, and you said it is okay, we can go ahead. So that when problems come, there is proof. Not that a doctor will lose his license because of false claims. The other one is whistleblower protection. That is providing protection for whistleblowers who report fraudulent activities and can encourage individuals to come forward with information. A lot of you have heard of a lot of people that died because they chose to speak out. A lot of people have been killed because of that. So we need to ensure that these people that step forward to say the truth are protected, that they are safe, their families are safe. Another point is legal action. Taking legal action against individuals or organizations found guilty of medical malpractice fraud can act as a deterrent or to others. Legal actions means that don't try to cover up everything. If somebody does something wrong, then they should be aware of the consequences of what they do. They should face the consequences of their actions. Taking legal actions. If somebody does something wrong, go to the court. Don't try to put matters into your own hands. Go to the right people. Another point is technology and data analysis. This is utilizing technology and data analysis techniques to identify patterns of fraud and abuse and can help detect and prevent fraudulent activity. Again, the use of computers, the use of technology is needed. But like I said earlier, that we could video, you could record sessions. It must not really be a video. It could be audio or other forms of documentation that technology can be used, that can be utilized. The last point is overall, by implementing these strategies, I believe that the healthcare system can be better and cases of malpractice can be reduced. So thank you all. And the group members that participated in this article is me and myself, and I am Bridget Ineka Wabupo, and Grace Onoja, and Emmanuel Grace Amarachi. Thank you all for listening.
Thank you very
Hello.
much, Bridget, thank you very much, Bridget, for stepping in to make the presentation on behalf of your group members. We appreciate your confidence and your ability to handle that. We say thank you also to the group 2 or group 1 members that were able to make the significant contributions to ensure that the presentation was done and done rightly. So we would like to have group 2's presentation. Please, I would like for us to have it very fast, if possible, just 10 minutes, so that we can hear from Mr. Ebenezer, his contribution, and he can also give us a control to today's session. So, Ruben, please, you can carry on. I'll start sharing my screen now.
Okay, thank you, sir. Good evening, everybody.
Good evening.
Okay, nice. So we are the members of Group 2, or this presentation was compiled by the members of Group 2 for the JIIPCC program. So our topic is safeguarding patient rights in healthcare settings. In healthcare settings. In the world today, data from various healthcare systems worldwide have revealed alarming rates of patient safety incidents. And if you're a Nigerian and you live in Nigeria, you would hear of cases like medication errors. That's a doctor, a fully trained doctor is going to say, oh, I'm sorry, I gave you the wrong medication. And that is bad. Surgical errors. Growing up in Nigeria, before studying medicine, everybody kept telling me that don't be a doctor that will forget the scissors in your patient's belly during surgery. And those things actually happen, especially in developing countries like Nigeria. Hospital-acquired infections. That's you go to the hospital for something, then you come out with another infection just because the hospital is not disinfected properly. Then misdiagnosis. This is very common in Nigeria as well. So with these problems happening in the world, there's a need for us to focus on patient rights in healthcare settings. Next slide, please. So what are patient rights? Patient rights are a set of principles that protect individuals seeking medical care. So straight to the point, if you are a patient going to a hospital for any reason at all, there are certain rights that apply to you that you are entitled to. Just like how you, when you say you're a citizen of a place, there are certain benefits that come as being a citizen in your own country. There are basic rules of conduct between patients and medical caregivers, as well as institutions and people that support them. Please, next slide. So these are the fundamental patient rights in health settings. Rights to informed consent, This is to say that as a patient, when you go into a healthcare facility, it is your before any procedure is done on you, it is you have to give them the consent to be able to do any invasive procedure on your body because it's your body. You can't go to a hospital now and the doctor says, oh, we need to do a lumbar jack on your spinal cord. And he's telling you, you must do this now, you must do this. No, that's not possible. You have to be the person to accept the procedure and say, okay, yes, I think we should go ahead with this procedure. Right to privacy and confidentiality. That's very important as well, because you know there's a problem of stigmatization going around the Nigerian society. For example, people living with HIV and AIDS now, you as a doctor, sorry about that. As a health practitioner, you can't just go around talking about your patient's condition. Right to quality care. This one is very important because I see it in many Nigerian health facilities where you go there and quality care, it can't be described as quality care. Quality care is when you go somewhere and you are okay with the service 100%, how you were treated, from how you were greeted at the gate to how you were diagnosed, how your treatment was given. Right to refuse care. This is very important as well. When you go to a hospital, if you don't believe what the doctor is saying, hello, can you hear me, please? Sorry about that. Let me put my device on. Do not.
Yeah, yes, we can. I can hear you.
Okay. So, rights. You also have the right to medical records. That's also an important aspect of patient's rights, because when you go to the hospital, you can ask the medical practitioner to show you your medical record with the hospital. Please, next slide. So these are some positive impacts we came across, positive impacts of knowing your patient's rights. As a patient, it's very important that you know these rights, you know what you are entitled to have. So when you know these rights, you get reduced medical errors and adverse events. That's when patients are well informed and actively involved in their care, they can help identify and address potential risks and misunderstanding with the doctors. When you know your rights, there's enhanced trust and communication between doctors and patients. This means that they are more likely to trust the healthcare provider and engage in open communication. Like when you trust somebody naturally, it's more likely that, oh yeah, you talk about what is wrong with you directly without hiding any facts. Then there's a better health results. When you know your patient's rights, patients who are actively involved in their care and have their rights respected are more likely to adhere to the treatment plan, because it's not just the doctor telling you what to do. Next slide, please. Okay, we came up with this example. This is an example of the significance of these rights. Despite the stigma associated with HIV and AIDS in Nigerian society, patients will feel reassured that their diagnosis will not be disclosed without their explicit consent. This adherence to privacy and confidentiality rights enables the patient to access necessary care without fear of discrimination or social repercussions, while preserving their dignity and trust in the healthcare system. So this example is very, very important in Nigerian society, because most people living with HIV and AIDS would rather die than tell their neighbor that they have HIV and AIDS. And some healthcare facilities in Nigeria, they don't even care. They don't even care that, oh, this person doesn't want their neighbor to know about it. It's within their rights for you to preserve this information and make it confidential. So next slide. So we identify some challenges in safeguarding patients' rights. Majority of Nigerian patients are ignorant of their rights. So this is very important because you have to know these rights before you know that your right is being infringed on when you get to a healthcare facility. So this widespread of ignorance make healthcare workers treat patients with disregard, either during physical consultation or in handling of their personal data. So when a doctor knows that, oh, this person doesn't even know their patient rights, there's no accountability on the doctor's part, because the doctor will know that, okay, I can do whatever I want. I'm the doctor, and there's nothing this person can do. Another issue is the issue of corruption. The Ministry of Health should take an active role in guarding the rights of patients in healthcare system, as corruption is evidence in mishandling of funds. So this particular issue of corruption now is a challenge for patients' rights, because you can buy any information you want in a healthcare facility. I'm not saying every healthcare facility in Nigeria, but most of these healthcare facility, you can go in there and tell them, oh, I'm 34 years old today, but I want a birth certificate that says I'm 24 years old. When you pay the right amount of money, they would provide a birth certificate for you. And this is detrimental to the healthcare facility. And there's the issue of implicit bias and cultural sensitivity. Discrimination and bias can have a detrimental impact on patient outcome and experience, which can lead to disparity in healthcare delivery. So, okay, next slide. After, listening to all these problems, seeing examples of the significance of these rights, these patient rights, we came up with strategies that you can use for safeguarding these patient rights. So the first strategy we came up with is education and empowerment. Healthcare facilities can implement strategies to educate patients about their rights. Like in Nigeria, I know when people know their rights, they don't stop talking about it. For example, during the end SARS protests in Nigeria, when people realize that, oh, the policemen on the streets, regardless with the guns they are carrying, they have no right to tell you to come out of your vehicle to be searched. It became a nationwide protest. So if we can put the same energy in the healthcare system and educate people, let them know that, okay, yes, when you go to the hospital, the doctor has no right to force you to take a particular treatment. You have the right to tell the doctor, I want to see my medical record before I undergo any further treatment. That will really, really safeguard patient rights in Nigeria. Another strategy is policy development and implementation. Healthcare organizations can develop comprehensive policies and procedures that outline patients' rights. So this means that, the Ministry of Health has to be involved in this as well, to stick all healthcare facilities in Nigeria should follow a specific guideline that tells patients of their rights before treating them. For some of us or some people that have used healthcare facilities that are not in Nigeria, before you get treated, they ask you to the very basic detail. That's your genotype, your blood group. They want to know all these things. They want to put it in a record so that when you go to any other hospital, it's like a healthcare confidentiality messaging. That's, from this hospital, you can go to the next hospital. You don't need to tell a new doctor something that makes you feel insecure, that makes you feel different. Training and professional development is another aspect, another strategy of safeguarding patient rights. Healthcare providers should receive ongoing training and education on patient rights. It's very important to let these doctors know that patients have their rights. They need to be reminded over and over again. Because in medical school, they don't teach you all of this. You need to go out in the world and learn that, okay, this person doesn't like saying they have a decay in their tooth, because they don't want to be seen as the person with a decay in the tooth. So you don't have to say it in the hospital lobby. You can actually just call them into your office and say, okay, sir, I know you have a tooth decay. This is what we want to do for you. Are you okay with it? So educating healthcare practitioners will help in safeguarding patients' rights. And the last strategy is feedback mechanism and quality improvement. Healthcare facilities should establish mechanisms for patients to provide feedback and reports concern about violation of their rights. So if any patient should feel like their rights has been violated in any healthcare facility, there should be a process in place where you just go and report it. Then there will be a penalty given to whichever doctor that in question. Please, the last slide. So in conclusion, safeguarding patients' rights in healthcare settings is essential for upholding ethical principles in healthcare, for patient-centered care, and for ensuring equitable access to high-quality healthcare services. So thank you. And the next slide is for opportunities for questions. Or we don't have the time to do that right now? So thank you for listening. I hope
All right.
everyone.
Thank you very much. Thank you very much, Ruben. We were clearly heard. We heard the presentation. It was a wonderful presentation from your group. Well done to you and your group members. Thank you for
Thank you.
standing in on behalf of the group presenter who is currently absent to make the presentation. I'm sure Mr. Ebenezer, running through your slides, may have one or two questions for the group. So we'll just want to give Mr. Ebenezer the opportunity to give his feedback on the presentation, and also just kindly introduce us to our topic today and his own expose on what he would want us to know about healthcare fraud and abuse. Thank you, sir, for joining us. I hope you can hear us.
Thank you. Can you hear me?
Yes, sir, we
Hello.
can hear you now, sir. We can hear you, sir.
Awesome. Good evening, everyone. Nice presentation with reservation. Okay, firstly, let me start by applauding the last presenter. Are you a medical doctor, the last presenter?
Yes, sir, I am. Yes, sir, I am.
Okay, what's the name? Can you turn on your video? You were not here last week.
Yeah, I wasn't here last week.
Awesome. So what's the name?
My name is Ruben Ikapi.
Okay. Where are you based? What area of medicine are you specialized in?
I'm a medical consultant right now, but I still have to do some schooling to. I want to focus on cardiothoracic surgery.
Okay, awesome. Glad to have you on board.
Thank you, sir.
Your presentation was okay, but
Thank you, sir.
there are a lot of deficiencies. We need to embellish it. So I will come back to your presentation. The first group, please, who is the presenter? Can you turn on your camera? The first group, who did the presentation for the first group? Group one presenter.
Yes, sir.
Okay, what's the name?
Bridget, sir.
Bridget. Okay. Who are the people? You were on call last week, right? When you have a particular number of slides, right? Ruben, yes, I'm done with you. You can turn off your video. Okay. So group one, you people, you failed.
Mr. Ebenezer, can you hear
That is
us?
what, yes, I can hear you. Can you hear me?
Yes, we can hear you now. You were off for a minute, sir.
Oh, sorry about that. So what was the last thing you heard?
Where you were addressing the presentation of the group one of Bridget about the number of slides, sir. Where you were talking about the number of slides.
I can't hear you.
Okay, I think you stopped at the. I think the last place I heard you was where you were talking about the number of slides, sir.
I can't hear you. I can't hear you.
Okay, sir, the last place we heard you was where you were talking about the number of slides.
Okay, I was still on that. I said the number of slides we agreed last week. Your number of slides should not exceed 15. It is PowerPoint presentation. It is not a textbook. It is not a notebook. So you try as the training. Part of your presentation is to train you on how you even do your presentation. That's part of what you're doing here. It is not enough to put in content, put in words on slides and present. The slide itself has to be appealing. You saw the slide of group 2. Now, I noticed in your slide, the only heading you have in your slide is the introduction, healthcare fraud and abuse. The subsequent slides didn't have subheading. Okay, there are some of them that were, you just left them empty. You didn't put either it is a continuation, either it is a definition. So that is one, your arrangement of your slide. I'm taking on that first. So take that home. When next you're presenting, if you are submitting a slide for me, firstly, it has to be, the font size has to be 14. You can use any font of your choice. There are some slides, okay, look at your slide 3. That font size is either 10 or 8 or 12. It's not up to 12 even. So that uniformity is not there. Then some of your slides, look at your slide 6, even slide 5. Then slide 3, slide 7, slide 8. You can see how scanty they are. Slide 9 is just 2 lines. So you see that the way your slide is not properly organized. That is one. So take that home. Let's now look at the topic, healthcare fraud and abuse. Then you see people didn't send me the second slide, the second presentation. I don't have it, but we will speak to it. It's patient's right. So
Okay, sorry about that, sir.
okay,
It
look
must have
at,
been a mistake, sir.
there's no problem. Look at also your slide 3. You see how tiny the characters are. So you compare slide 3 to, let's say, slide 5. You will understand what I'm talking about. You compare slide 3 to slide 4. You understand what I'm talking about. So let's go. Healthcare, your contents, you tried in your contents, you tried your research, you tried, but what is healthcare fraud? We already know what fraud is. Deceit. Any deliberate, intentional attempt to deceive somebody, to present as real what is not. Now, bringing that to the healthcare system. Healthcare fraud can occur in different ways. Some are committed by healthcare professionals. That's either the doctor, the nurse, or any other healthcare professional. Some are committed by the accounting department, those who prepare the bill. They are not the doctor, they are not the nurses, but they prepare the bills. So they can do some maneuvering on the bills. Some are done in collusion with patients, particularly where you have people who use NHIS, who use health insurance. They go and present, make false claims in collusion with the doctor or healthcare provider or their HMO, such that the company will pay for services or treatments not received. Now, that is healthcare fraud. For the doctors, it comes in different ways. I had a friend who told me, can you hear me, please?
Yes, sir.
Hello?
We can hear you, sir.
Okay. A friend once told a story of a young doctor who was employed in a hospital, a private clinic. And patients will come, he will diagnose them, and he will see nothing serious. He will just counsel them, Madam, go and rest. You have stressed yourself so much. Go and rest. Give yourself bed rest, and you will get well. Nothing serious. They will go home. Some day will come. God will not let them lie down. Just give them bed. Let them lie down. Infuse them, put drip. If for nothing, when they are going, they pay good money. So that by the end of the month, we would have raised your salary and pay you. The young doctor said he was not going to do that. And he resigned from the job. So that's an example of healthcare fraud. Where people go to hospital and they are infused, they put you on drip over nothing. Ordinarily, you don't require that. Then they will give you, they will write treatments, medications that they have no effect on your body. So they will write it and give to you, and you go home. You will just take it, and maybe it is even blood tonic. That's all. You are not treating any particular ailment, and they bill you. That is healthcare fraud. Then some charge you, if it's still the same thing, for services that were not rendered at all. Then some inflate your bill. Then some, they unbundle the service. The service comes as a package. Maybe you're going in for surgery. Now they will now come and unbundle the service to say surgical blade, 5,000 naira, syringe and needle, this particular medication, XYZ amount. You have already paid for the total package, which is surgery, and everything is factored in your payment, but they will find a way of unbundling so that they extract more money from the patient. All these are healthcare fraud. So for the patients on their own end, they can collide with hospitals to extract money from their organization. Yes, this patient is sick. The patient has gone to hospital, but they will now tell the doctor to find a way to inflate whatever it is. So the doctor writes non-existent ailments because the patient does not have it. And they impute it in the insurance claim because the patient's organization is going to pay for it. And the money is claimed somewhere along the line, they know how to release their money. Although when we talk healthcare fraud,
So
Mr.
now,
Ebenezer, can you hear us, sir?
there was a network interruption. Can you hear me?
Yes, sir, but your voice is a bit low. It's a bit deep.
Hello, can anyone hear me? Confirm, please. Can you hear me?
Yes, we can hear you now, sir.
Hello, can you hear me?
Yes, sir, we can hear you, sir.
Hello.
We can hear you, sir.
Hello. Can anybody hear me? Confirm that you can hear me. Hello. Hello, can anybody hear me?
So we can
Yes,
hear you,
sir,
sir.
we can hear you, sir.
Okay. Okay. So I wanted to be sure. Now, how do you curb healthcare fraud? Firstly, it is thank God you people did patients' rights. One of the rights a patient has is right to information. Now, that information includes information as to the nature of ailments you have, the treatment options available, the probable side effect of each treatment option, and the cost implication of each treatment option. That is one of the rights, right to information. You need to know the cost of your treatment. Now, another right a patient has that relates to cost is transparent billing. Transparent billing means that the patient is carried along as the treatment is being administered, and as the bill is accumulating, the patient is being carried along and is being told, okay, you have a surgery. Can you hear me?
Yes, sir, we can hear you, sir.
Okay, so you have a surgery. Now, this surgery costs you 10,000 naira, you know. Then, if there is another medication, they won't just tell you, you are seeing it. This medication costs 5,000 naira, your bill is now 15,000 naira. If there is another treatment, they include it. This costs 5 naira, your bill is 15,000, 5 naira. As the bill is being accumulated, the patient knows till you do the total, the patient pays. So the patient needs to exercise his or her rights to information and enforce that right to transparent billing to know this is how much. The patient has the right to complain. That's another right the patient has as it relates to billing. So if you are not satisfied with the bill you were given, you have a right to ask for a breakdown. Now you don't do this with the accounting section only. You take it up with the management. So if you suspect that there is a fraudulent move or an attempt to defraud you, before you engage, just tell the accounting session, can you correct this thing or I escalate it? Nobody wants to hear that. And when you say you will escalate it, ensure you engage the management so that the management knows what their accounting session is doing. That is one of the most effective ways to curb. Now, when you talk about analysis or data analysis or analyzing the number of patients that have been treated, that is probably where the hospital is doing an audit. That's where the hospital may get to find out. But if it is on one-on-one with the patients, this is what I just said is the most effective way for the patient to even stop it, nip it in the bud before it happens. When we are talking about analyzing data, that is after the fraud has been committed. The hospital, during their audit, may analyze data, and the patient who is the victim of that fraud had already gone. The hospital may not do anything again to bring the patient. The worst the hospital can do is to fire the personnel responsible, basically the accounting people. But if it has to do with a doctor, the hospital takes it seriously. So as much as possible, try to exercise your right to information and your right to transparent billing to curb medical fraud at the patient's level. That's one. Then if we talk about medical negligence, what is medical negligence? It is basically the failure of a healthcare provider to exercise reasonable skill and care required of a personnel of his standing. What do I mean by that? If you are a consultant like Ruben, there are things we require you to do as a consultant. There are technical expertise we require you to have as a consultant. So if at that consultant level, you fall below that standard as a consultant, if you have given it, you are represented or given yourself out as a consultant, you are required to have the skill and expertise of a consultant in attending to a patient. So when you fall below that standard of a consultant, you are deemed to be negligent. Now, if you are not a consultant, there is also an expectation, reasonable care and skill at your level, which we expect. We do not expect you to operate as a consultant, but at that your level as a house officer. What you are supposed to know at that level, exhibit that skill. Now, if you fall short of that skill as a house officer, you are deemed to be negligent. Now, for us to establish negligence, there are factors. One, there must be duty of care for you to prove negligence. There must be duty of care, showing that, meaning that the doctor, the healthcare professional, owes the patient duty of care. So once a patient-doctor relationship is established, the doctor owes the patient duty of care. Once a doctor accepts or receives patients for treatment, the duty of care has been established. So once you establish duty of care, one. Two, you need to prove that the doctor is in breach of that duty of care, meaning he has not lived up to his professional expectations. Then three, you need to prove that there is harm. As a result of the breach of duty of care, the patient suffered harm. You need to prove it. Now you need to prove also what we call causation, the link between the harm the patient suffered and the failure of the doctor to meet up to his obligation. So those are the four ingredients or elements you must establish to prove negligence in court. So what are the different kinds of negligence? You have misdiagnosis. That is where somebody has a different ailment. The doctor diagnoses a different ailment. A senior advocate, a celebrated senior advocate in Nigeria, was misdiagnosed some time ago and he died. He had cancer. And the hospital, the doctor, they were diagnosing something different and they were treating something different. Before it could be known or realized the man had cancer, it has gone beyond rescue and we lost him. So that is one for misdiagnosis. Now, there is medication error. For medication error, you can't be giving the wrong medication outrightly because you know some medication, they sound alike. So you might want to prescribe, we even have prescription error to start with. So you want to prescribe a particular medication, you mistakenly prescribe the other one. Now that's prescription error. Then if you now talk about medication error, you talk about the dosage. Is it after the class? I'm going to post an article I wrote on medication harm in celebration of World Patient Safety Day 2022. So I will try and look for that article and drop it on the group. So if people should read it. Now, for medication error, we talk about the dosage. You can be giving overdose, that is medication error. It can be underdose, that is medication error. It can be the wrong route. If it is a medication that you are supposed to, for example, inject, that's tablets that you are supposed to take, and they now give you the injection equivalent. The route of that medication is mouth, but they have given it to you as injection. One could even be injection. The route could be intravenous. They are supposed to inject you through the vein, and they injected you through the buttocks. That is medication error, because it is a wrong route. Now, you talk about timing. Are you supposed to take it 3 times a day? Are you supposed to take it maybe every 8 hours? And you have taken the first one, the first 8 hours. Then within the next 6 hours, he now comes and gives you the medication, the right timing, the right medication, the right dosage. Then you talk about documentation. You know that you see nurses with charts. If they have been given medication and the nurse forgot to chart that you are taking that medication, the next nurse coming to take over comes and looks at the chart. You have not been giving your medication. That one comes to administer again. It's already overdosed. So these are some of the medication error. Then you even talk about equipment error, handling of hospital equipment, a lot of things. Now, maybe you know these hospital beds that you can adjust to different angles. Now, the element requires that the patient's leg is hung maybe 90 degrees. Maybe the patient is supposed to lie down like this. This is his back, like a V shape. And someone comes and sets the bed like this, flat. The patient is lying flat. Now, that is negligence. Because the treatment the patient is supposed to get, that posture, that position of the patient is part of the treatment. But someone who is not trained on how to set that bed goes to set it wrongly. The outcome will be different. So that is a medical negligence case. I also last year, I think 13th July last year, I was at University of Abuja Teaching Hospital. Firstly, 6th of July, I was at University of Abuja Teaching Hospital to train their nurses on medical negligence in nursing practice, changing the narrative. I posted that the whole material I used on my Facebook. So go and read it on medical negligence for nurses. On the 13th of July, I was back there last year to train the doctors on avoiding medical negligence. So all the types of negligence, the examples, they are contained in that material. It's on Facebook. Just check my name, Ebenezer Iguatu. Go through, you will see those articles. Read it. You have everything you need to know about medical negligence up to the consequences. They are all contained there. Now, to patients' rights. Like I told you, I don't have that material, but patients' rights, what is patients' rights? I have done some work on patients' rights, and if you check your definition now, right, is an improvement on the existing definition so far. Most times, if you try to check what patients' rights are, they just list the rights. Patients' rights are the set of rights that patients has as follows: right to informed consent, right to privacy, right to confidentiality, and then list it. But over the years in doing the work, I attempted to define patients' rights, which is, excuse me, let me get that definition. The way I put it, patients' rights are those rights that guarantee professional, quality, transparent, and safe healthcare delivery to a patient, as well as respect to the dignity of the person of that patient by healthcare professionals while providing healthcare service to the patient. Now, let's break it down. Patients' rights are the rights that guarantee, firstly, professional, meaning that the person who is even attending to the patient must be a qualified healthcare professional or healthcare personnel. Number two, it guarantees quality. This right, well, we will list the rights, but this right guarantees one, professional, two, quality, three, transparent. We have talked about right to transparent billing. Now, for safety, because we have unsafe care, which is a serious issue. Then we talk about respect to the dignity of the person of the patient. One of the rights a patient has is right to dignified care. So any form of abuse, whether physical or verbal abuse, is an abuse, a violation of the patient's rights. So if you are treating a patient in such a manner that you strip that patient of his or her dignity, it is no longer treatment. It's a violation of the rights. For example, if you have visited a general hospital ward, you will notice that you will see blue-like curtains, like screens. Some of them are light green, some of them are lemon in color, some of them are sky blue, some are white. I don't know if any of you have seen such. So if you visit hospital, good. Now, what they are doing, anytime they are treating a patient, they will use that thing to cover the patient's rights or seclude the patient's bed space to the best of their ability. What they are doing, they are protecting the patient's rights to privacy, one, and they are protecting the patient's rights to dignity. You do not, because you are treating a patient, you now expose the patient's nakedness to the whole world because the patient is receiving treatment under your care. So, can we do a rundown of a few patients' rights? Number one, there is a right to information. I've mentioned what it is. Now, two, right to information. Information as to the nature of the ailments, information as to the available treatment options, information as to the probable side effects of each treatment option, information as to the cost of that treatment. So you do not miss any of this. If you come and tell a patient, okay, the only treatment, how many of you are aware that King Charles has cancer now? The King of England.
Yes,
Hello?
sir, I'm aware, sir. I'm aware, sir.
Beautiful. Beautiful. It's in the news. So now they have said they are going to treat him with herbs. He's not going to undergo chemotherapy that we all do. So treatment option. So if you now say, okay, you have cancer, the only treatment option is chemotherapy. You discover that you are abusing that patient. You have not given the patient sufficient information as to treatment options available. So you can say there is the tradomedical approach, which is herb. So there is chemotherapy. Then there is radiotherapy. You list all the available treatment options. The patient will now weigh these options in line with his or her pockets. Okay, herbs will cost you $50,000. The side effect is that when you are finished drinking the herbs, the cancer might go, but you might lose one of your eyes because how do I call it now? The composition of the herbs it's not compatible with your eye. So there is 50-50 chance that by the time you complete your treatment using herbs, it might affect one of your eyes. So the person now weighs it. And I say, okay, chemotherapy. Well, if we use it, you will suffer loss of hair. In fact, you might go bad for the rest of your life. The person weighs it. But that one will cost you $70,000. The person weighs it. You give treatment option, the cost, the probable side effects. When you are done, the person will now decide the one he wants. That is when we say the patient has made informed decision. That brings us to the next right to informed consent. Now, consent, there are factors that can vitiate consent. If that consent is not informed, if that consent is secured by duress, if the patient is a minor and is not qualified to even give consent at all, if the patient is a person of unsound mind, that consent will be vitiated. What is consent? Consent is basically approval. I give you authorization. I give you the go ahead to treat me. Now, there is a 1914 case that summarizes what informed consent is. It is a law, we call it locus classicus on consent. And that's the case of Splendorf against Society of New York Hospital, 1914. Lord Cardoso, in that case, while giving his decision on consent, he said, every human being of adult years and sound mind has a right to determine what shall be done to his body. And a surgeon who performs an operation without his patient consent commits an assault for which he is liable in damages. This is true except in case of emergency where the patient is unconscious and where it is necessary to operate before consent can be obtained. So as little as touch without permission of the patient, you have committed an assault and you will be liable in law. So that's rights of a patient to informed consent. A patient has a right to treatment in emergency situation. Firstly, you need to know that in Nigeria, the presenter, you were talking as if there are no measures in place to guarantee and protect patients' rights in Nigeria. There are, in fact, laws in place. We have the National Health Act 2014, from section 20 to about section 26, guarantees patients' rights. We have the Compulsory Treatment and Care for Victims of Gunshots Act 2017, which protects and guarantees the rights of victims of gunshots. Before now, if any person had gunshot wound and go to the hospital, that person is required to bring the doctor's reports before to bring police reports before the commencement of treatment. But it is no longer so. In fact, section 1 of that right says every hospital in Nigeria is mandated to receive and treat adequately with or without police reports persons with gunshots. Now, section 2 says that hospitals should receive and treat persons with gunshots with or without initial deposit of funds. Meaning that if a person with gunshots comes to the hospital, you cannot say go and deposit 100 million, go and deposit 50 million, go and deposit 10,000 before we commence treatment. The law requires the hospital to commence treatment to save life first. Now, that brings me to the provision of section 20 of the National Health Act. I think I mentioned it in this class last week. Section 20 says that hospitals in Nigeria should not deny patients treatment in an emergency situation for any reason, meaning there is no reason you will give as to why you refuse treatment in emergency situation that is justifiable in the eye of the law. Now, what are emergency situations? Example is accidents. Another example is snake bites. A woman in labor who is delivering is emergency. Gunwood is emergency. Knife stab is emergency. Bite, snake bite, or scorpion sting, dog bite. These are emergency situations. Cardiac arrest is emergency. So any patient who is presenting any of these conditions is entitled to be treated without denial. You can't turn that patient back. You cannot say we do not have hospital space, that we don't have space. You can't say that. It's not tenable. You cannot say we are on strike, so you are shutting the door. You cannot say that. Once a patient meets somebody in the hospital who is a healthcare provider, that patient in emergency situation is bound to receive treatment. Now, the law is that's section 2, subsection 2 of section 20. The law is that where a hospital denies patients treatment, that hospital, if found liable, will pay a fine of 100,000 naira. That's the healthcare professional who denied that treatment. If found liable, we pay a fine of 100,000 naira or serve a jail term of not more than 6 months or both. But the challenge has been, Nigerians are aware of this, their rights. The answer is no. There is poor sensitization about these rights. Another right of a patient is right to privacy. We talked about it. That's what we see. Right to privacy has to do firstly with your physical body, the person of the patient. Then right to confidentiality has to do with his medical report, medical record. The patient also has the right to access that medical record. Another right a patient has is a right to clean, safe, and secure healthcare environment. So there have been cases where armed robbers will go to hospital, rob patients, rob doctors, and go home. Such patients can actually sue the hospital because the patient has a right to safe, secured, and clean healthcare environment. That is provided under the Patient's Bill of Rights 2018. So, another right a patient has is a right to complain. That is section 30 of the National Health Act. So you can actually lay complaints to register your displeasure as to the treatment you received. A patient has a right to seek redress. Now, let me talk about right to complain a little. You can complain to the hospital management. In fact, if you go to hospital, you will see cervical boxes. You will also see phone numbers displayed somewhere around the hospital. Complain to this, call this number, cervical desks. They have their place in hospitals where patients are expected to complain. Unfortunately, patients do not utilize this available medium of complaint. Now, another thing a patient can do as a complaint, we have prosecuting redress, we have administrative redress, which is complaining to the hospital, the healthcare service provider, the management. We have professional redress, which is complaining to Medical and Dental Council of Nigeria. I told us last week, Medical and Dental Council, they do not regulate hospitals, they regulate doctors. So part of your right to information as a healthcare, as a patient, is the right to know the name of the healthcare personnel treating you and his qualification. That's why you see doctors wear name tags and nurses, they wear name tags. Now, the standard practice, the healthcare provider is supposed ordinarily to volunteer this information to you as a patient. To say, okay, I am Dr. XYZ, these are my qualifications, just to guarantee you that you are in safe hands. You are not being attended to by a quack. But what we have here is doctor comes and just, how are you? Ask about you without telling you about himself, then commences treatment. Now, where something goes wrong, you do not even know the doctor who treated you to complain. So it's important you know where the doctor does not volunteer that information, you ask his name politely, he should be able to tell you. So for professional redress, you complain to Medical and Dental Council of Nigeria. They have a committee that will look into your complaint. If there is merit in your complaint, they set up a tribunal where the doctor will be tried. He will come there and defend himself. Then, of course, you have right to seek legal redress. Now, for legal redress, there is the criminal aspect of it, there is the civil aspect of it. Now, for civil cases, or let me start with the criminal. For criminal cases that involve outright medical malpractice. Now, there's a difference between medical negligence and medical malpractice. The difference is intention. Medical negligence is a mistake, it's error. Do you understand? The doctor didn't set out to cause harm. The doctor, even if where the doctor caused harm, it was done out of mistake. But for malpractice, it is an intentional and deliberate act to cause harm to the person of the patient. Example is organ harvest. I don't know whether you followed up the story of a woman whose kidney was stolen in Plateau State. She went to hospital for surgery and they stole one of her kidneys. That was last year. So that's a classical case of medical malpractice. It is theft. Now, one of the cardinal principles of healthcare is the principle of non-malfeasance, do no harm. So as a doctor, you have to save life. You cannot, even benevolence, you cannot just wake up to cause harm. So in such case of organ theft, it is malpractice. Now that doctor will be charged to court. Firstly, you report to the police investigates the case. Then if there is merit in it, the doctor is charged criminally. He prescribed under our criminal law jurisprudence. Another case is where the act of a doctor leads to death, murder. Now there's a difference between murder and manslaughter. If it was intentional, there are cases you know you are a trained doctor. You know that if you cut this particular vein or artery, this patient will bleed to death. You know that if you give the patient this dosage of this particular medication, the resultant effect will be death. So if knowing this as a trained professional, you do it and the patient dies, you have committed murder. So you will be tried under our criminal law. That is criminal aspect. Or you do anything that leads to loss of organs. That's criminal. You will be liable under our criminal law. Then, under our civil law, cases like you are supposed to amputate the right leg, you amputated the left leg. That's negligence. In fact, we have a case like that, Tanko's case, where Okekaro against Tanko, where the doctor erroneously did the surgery on where he's not supposed to. He doesn't have a consent to do surgery on that finger. He went ahead to do that surgery. There's a case, I think, in North Korea. A woman was pregnant. Two women, actually, were pregnant. One came for abortion. The other one came for antenatal care. They now aborted the baby of the woman who came for antenatal care. So, in this type of case, you sue for negligence under our law of torts, and you get damages in court. Then, another right a patient has is a right to religion, religious observation. Now, a right to religious observation, you cannot, for our Muslim brethren who have their time of prayer, except where the patient is violent, except where that will affect the patient, the medication, then a patient should be allowed access to have his religious observation. Same thing goes to our Christian brothers who pray. So you cannot say that, okay, because you are receiving medication, you will not observe your religious practice. No. A patient has a right to visitation. Now, a patient also, that's a different right from religious observation. A patient has a right to visitation. A patient has a right to decline, to refuse medical treatment. Where that patient is of sound mind, and where the patient is an adult and of sound mind and understands the consequences of his or her decision, the doctor is bound to respect that patient's decision. So if you have been treating a patient and along the line, the patient says he or she is no longer interested in the treatment, he wants to discontinue, you have to respect that patient's right. Then get the patient to sign a form that he was discharged or he's discontinuing against medical advice. Once the patient signs that form, you allow the patient to go. You do not insist that you must receive this treatment. Now, if you have discharged the patient, that's one right to discontinue treatment or to decline or refuse treatment. If you have if the patient has refused treatment and gets out of the gates and changes his or her mind and turns back, you are bound to receive that patient and continue treatment. So the patient has the right to continuation of treatment. So right to refuse treatment, right to continuation of treatment. Now, for persons, for Ruben who is here, what most of your colleagues do is for when patients come in emergency situation, they just send them away. I call it dismissal. They dismiss the patient. Madam, go, go, go. Let's assume you are in hospital A. Madam, go. We don't have bed space here. Go to hospital B. Now, for me or for us in medical law, we call it dismissal. What we are supposed to do in that situation is to refer the patient. Referral is medical service. Come out, check the patient, write a letter of referral, give the patient, okay, go to hospital X. Now, for you to be able to write a referral letter, it means you have examined the patient. So let's say this is an accident victim who is rushing in his pool of blood. You do not have bed space. Sincerely, you do not have bed space. But then, you do not just say go. For them to know that they are coming from one hospital, because you want to save life. If they go to hospital B without any notes, they are most likely to be rejected the same way you rejected them. They are most likely to be dismissed the same way you dismissed them. So you write a referral note and give them. When they go to that hospital B, they say, okay, we are coming from hospital A. This is the referral note we were given. Then they can now be admitted by hospital B. So in summary, the patient, these are not all the rights the patient has, but I can just pick on this few. So let me talk about sources of patients' rights in summary so that you understand. Now, patients' rights in Nigeria or world over, patients' rights are derived from different sources. Firstly, international treaties, like Universal Declaration of Human Rights, like the Constitution of the World Health Organization. A lot of African chapters provide for patients' rights. The Helsinki Convention, the Helsinki Declaration, the Lisbon Declaration. All these are, even the Hippocratic oaths for doctors, all these are sources of patients' rights classified under international convention and treaties. Then you now have our local laws. Within the country, you talk about the acts of the National Assembly. Number one on that hierarchy is the Constitution. The 1999 Constitution as amended. So you talk about chapter 4 of the Constitution, where you have what we call fundamental human rights, starting from section 33, which guarantees rights to life. So as a patient, you have a right to life. The essence, every other, even the treatment, why the doctor is treating you, is for the patient to be alive. So you also have a right to the dignity of the human person. We talked about dignified care here. So some of these rights are extracted from the Constitution. Then, after the Constitution, you have the National Health Act 2014, which is more like the law that governs our healthcare service delivery in the health sector generally in Nigeria as of today. So, acts of the National Assembly, National Health Act falls under this. The compulsory care and treatment of gunshot victims falls under this. The HIV/AIDS Anti-Discrimination Act 2014 falls under this. Then you talk about state laws. Lagos State has their own HIV/AIDS Anti-Discrimination law. Then Rivers State has their own compulsory treatment and care of gunshot victims. Then you talk about regulations, things like what's it called again? The Patients' Bill of Rights 2018 was that document was prepared by then Federal Consumer Council, then Consumer Protection Council, now Federal Competition and Consumer Protection Commission. So they put together the Patients' Bill of Rights. There are about 12 rights of the patients, 11 rights of the patients contained in that document. Then during the COVID-19, the National Human Rights Commission came up with minimum standard human rights of persons receiving COVID treatment in isolation centers in Nigeria. So that minimum standard of rights can fall under regulation as a source of patients' rights. Then you talk about the professional code of ethics, the code of ethics of different professions, different disciplines of healthcare professionals. So for doctors, you have the code of medical ethics. Some rights there, some rights of the patients are contained. The way the doctors should relate to the patients, they are contained in that document. For nurses, you have the code of professional conduct for nurses, the same for pharmacists, for laboratory scientists. So these are different sources. As we speak today, we do not have a single document in Nigeria that contains all the patient's rights. No, we do not have. So if you are handling any patient's rights issue, you have to search out the law that covers that particular case of the patients. So I think that is the summary, an overview. Patient's rights is deeper than how many minutes. We just have how many minutes to do this. So I have to touch here and there so that we have an overview of what patient's rights are. Thank you very much. If there are questions, I'll be more than willing to receive them.
Thank you very much, Mr. Ebenezer. This class has been, I don't know about our mentees, but I'm sure, just like me, they've learned a lot. So thought-provoking in that sense, a lot of thought-provoking and simple to understand things that Mr. Ebenezer has laid out for us today in this session. I'm sure there are questions, things that we are unclear of, we may be unclear of, and or may need further clarity on. Right, so this is our question and answer time. Please, our mentees, you are advised to ask questions so that we can get maybe further clarification on some matters that you are unsure or unclear of. So please, if you have a question, quickly indicate. We are almost running out of time, so we would like to take our question and answer session very quickly. Okay, I can see Mr. Ruben raising his hand. Please, you can unmute yourself and ask your question.
I expected a question from Mr. Ruben. In fact, if he didn't ask a question, I'll call him to ask one.
Good evening, sir. Thank you so much. Thank you so
Good
much.
evening, my brother.
It was very nice. Thank you. The only question I have concerning the patient's rights is in Nigeria, for example, I've been in the hospital where people with stab injuries were sent back, they were sent away. And these people, it wasn't the hospital's fault per se. It was true that okay, yes, then doctors were on strike. So there was nobody fit enough to actually take on that stab wound injury. But the person was just sent away and nothing was done. Some weeks later, the relations of the person came to the hospital saying that, oh, we killed the person. So my whole stay in the hospital, this was my Tama district hospital. So my whole working there, nothing was done in terms of that. It was just a case that just died down. So my question is, how do we implement these laws? Because
Are
today
you
now, this
referring to
Nigeria,
last
we have
year's
so
case?
many laws.
Are you referring to the recent case of greatness?
Sir, I'm not hearing you.
I said, are you referring to the recent case of the lady that was pushed out by one chance? When are you still in Metama?
No, I'm not in Metama anymore. This happened in 2022.
Okay,
This happened in
okay. So
2022.
last year there was a recent case of a lady who was pushed out, and that scenario played out again. Go ahead with your question.
Oh wow, wow, that's coincidental. Okay, sir. The question I'm asking is, how are today now I've learned about so many laws. How are these laws implemented in Nigeria? Because as a medical provider, it's painful to see that these things are written on paper, but they are not really. It's not implemented in reality. So, what are the
Okay,
things put in place? Like, how can a doctor help somebody in that aspect?
okay. I like your question. Firstly, I have an organization, I run an NGO. Lawyers Arise for the People Initiative. What we do is patients' rights advocacy. What we do is patients' rights sensitization, awareness creation, and taking up cases of patients. Do you understand? The major challenge is that there is no sufficient awareness creation by the relevant government agency, particularly the National Orientation Agency. For example, you notice during election, there are always jingles and campaigns about do not buy votes, do not engage in election violence. Do you understand? Then, when there is increase in vandalization of government properties like maybe pipelines and electric, electricity installation, you also hear jingles, do not engage in pipeline vandalization or all that. If dry season comes and people are beginning to do bush burning, pursuing bush rats, the government creates jingles. But when you have passed a law as important as laws that safeguard the rights of patients, you do not see any jingle. Do you get it? So the National Orientation Agency is not doing its best in terms of awareness creation. And that is where organizations like us step in to bridge the gap by carrying out sensitization campaign. In 2021, we were at University of Abuja, FCT School of Nursing to train their nurses on the role of nurses and midwives in promoting patients' rights. You understand? I told you last year, the CMD of Abuja Teaching Hospital called on us to come and train their nurses. We finished training their nurses on the 6th. On the 7th, they called us to come and train their doctors. We trained them. In fact, there's a flyer I will post on the group on the 29th of this month. I'll be training, God help me now, Medical and Dental Consultants Association of Nigeria. I'll be training them on wait, let me get the flyer out. So I'm trying to remember the topic. flyer. My picture is in the
Mr. Ebenezer, can you hear us?
middle. Uh-huh. Exploring the difference.
Okay, it seems Mr. Ebenezer's network logged him out. I'm sure he'll be rejoining us soon enough. Once he does, we'll still be. I'm sure he will help us run through that question, and then we'll be taking the next question. So please, let's kindly bear a little patience with him. I'm sure he's working on it to rejoin the class. Okay, yeah, welcome back, sir. Hello, sir. Can you hear us? Hello, Mr. Ebenezer. Mr. Ebenezer, are you with us? Okay, please, sorry for the network issue. Okay, you're welcome back, sir.
Hello, can you hear me now?
Yes, sir, we can hear you now, sir. Hello, sir. It seems like your net. It seems like you are not audible, sir. Can you hear us, sir?
Can you hear me now?
Yes, sir, we can hear you now.
Anything?
Okay, we can hear you now, sir. Hello, sir.
Can anybody hear me?
Yes, we can hear you now. Your network is shaking.
Hello,
Yes, sir, we
can
can
you
hear
hear me
you.
now?
Yes, sir, we can hear you.
Okay, I wasn't hearing anybody. Okay, so back to the question Ruben asked. I said, firstly, there is no sufficient awareness creation. A patient, you cannot enforce a right you do not know that you have. One. Two, you cannot enforce a right when you don't even know how to go about it. So there is need for awareness creation. Then for you as a doctor, how you can help is to do the right thing. Today you have learned that you don't have to dismiss a patient, but you refer. So even with one, you doing the right thing, two, sharing the knowledge you have gained here with your professional colleagues. Three, now that you know that we offer these services, your colleagues, if you are in a I don't know a hospital you work with, but you can make arrangements to private hospital. We come and train your people with training and capacity building for health. Then I also train lawyers because firstly, medical law is a specialized area of law. Medical negligence cases is a specialized area of litigation. So it is not a also trained lawyers. In fact, last year we trained a Gariki branch of the MBA. If they read my profile today, I don't know. Presently, I serve as the chairman of the Health and Medical Law Committee of Gariki branch. It was after they were in place, but it wasn't functional. It was after my training, they invited me to train. After training them, the chairman of the branch reached out to me. Said, Benisa, please come and head this committee for us. That's how they appointed me the chairman of the committee. Initially, I wasn't in that branch. So we are training lawyers, we are training doctors, we are training healthcare professionals. So that, and we are at the same time sensitizing Nigerians to be aware of these rights. So what I'm going to do for you, Ruben, are you based in Abuja?
Yes, I am.
Okay. What's going to happen? Let's connect after this class. Chat me on the group, on the WhatsApp. So I will give you opportunity to be a member of our NGO. We also have some doctors who are members. In fact, our outreach in University of Abuja Teaching Hospital was coordinated by one of our doctors. And I was there too. So we have professionals. Then we get you to join our professional body too. Where's the lady? Where's my learned colleague? Is she here? What's her name again?
I think it's Rachel, if I'm not mistaken. She's not with us in today's session.
She's not on course today. Okay.
Yeah, she's not here.
Okay. So I will also get you to join the Institute of Medical and Health Law. We are the foremost institute of lawyers and doctors coming together. We have doctors who are members of the institute. It's the first institute of doctors and lawyers coming together under one umbrella to pursue the same cause, which is ensuring that patient safety is encouraged and the issue of patients' rights violation is drastically reduced in Nigeria. So I will also bring you on board. I think someone is raising her hand. Uloma, right?
Yes, Uloma, please, you can go ahead and ask your question.
Question.
All right. Good evening, sir.
Good evening.
When we were teaching, you made a comment about cases where armed robbers attack a hospital and that
Yes.
the patients
Patient has
have
a
a right
sue.
to sue.
Exactly.
On what grounds exactly can the patient sue the hospital?
Okay, I just told you that the patient has a right to clean, secured, and safe healthcare environment. When a patient leaves his house to come to your hospital, the patient has handed her security over to you. Do you understand it? So
Yes,
if a
sir.
patient is within your hospital premises and the patient is attacked, the hospital is liable for the security of the patient as long as the patient is within your hospital environment. I will trace that picture, I will trace that video. There's a video I shared it on my Facebook page. It's going to be a long scroll where a monkey, I don't know if any of you ever saw that video, a monkey found its way, in fact, not even one, like 3 or 4, found their way into a hospital ward and was jumping from one bed to another. Some will take patients' items like bread or fruits that we carry it. And I saw a particular patient who was being transfused. You could see the blood. You could see the line. The patient was being transfused. My fear was just let this monkey not jump and go and pull that in. Do you understand me?
So
Yes, sir.
once I have also seen a video where a cow entered the hospital. So the hospital owes that patient a duty of care. Once the patient steps into your hospital, the security of that patient is your responsibility. So it's a right to clean. He talked about hospital-acquired infections. That's Dr. Ruben. He talked about hospital-acquired infections. So if your hospital environment is not clean, the patient is possible will likely go home with a different infection. Now, when I talked about medical negligence, I told you to go and read the material I posted, or maybe I can do you a favor of sharing it in the WhatsApp group. I'll just copy it and paste there. Read it up. You'll see that things like bed sore, not turning the patient as at when due. The patient can lie on the bed for long and go home and get bed sore. Now, that's issue of negligence. But issue of security, the hospital has a gate, a security personnel at the gate that they pay salary. So how did the criminals break through that security, come into the hospital and attack the patients and even rob doctors? Yes, you might say they are armed robbers. Yes, but the hospital is liable.
Okay.
Once the patient
All right. Thank
enters
you,
your
sir.
hospital, you owe that patient a duty of care, including secured environments. Any other question, please?
Yes, sir. I have a question.
Yeah. Who else? Okay. Miracle. Ask your question.
Okay, good evening, sir.
Good
My name is
evening.
Miracle Oyoko, and I have a question. You mentioned on one of the rights of the patient that the patient has the right to be given information. They're supposed to be given information, and if the medical personnel in the hospital don't comply with this, then they are going to be liable. I want to ask, is there any system of checks and balance? Because if there's supposed to be a system of transparency, if there's supposed to be transparency in the system and the patient being given the opportunity to exercise the right of to get information, if is there any established system of checks and balance in Nigeria? Because where the hospital does not comply with this duty on them to ensure that the parents has enough opportunity to exercise this right, and the patient, sorry, to is not aware of this right and does not exercise the right, then in that situation, now there are situations whereby the patient suffers damage, and it can happen a lot, and they will not even know that their rights are being breached, and they may start having several medical complications. But at that point, that they don't know about that right that they have, so there might be a particular doctor now that might be getting.
Miracle.
Hello, I have lost you.
Miracle, are you still with us?
I've lost you.
Miracle, can you hear us?
Hello, yes, I can hear you. Can you hear me?
Yes, you
Yes,
said
we
there
can
might
hear
be
you.
a particular doctor that did what?
Okay, sir, I was saying that there might be a situation whereby a particular doctor can be giving wrong diagnosis or wrong prescription to a particular patient, and they don't know about this because they've not been given this information. So I'm asking if there's any system of checks and balance to ensure that the hospital is complying with their duty to respect the rights of patients.
The only system is to get the patients empowered with information, with knowledge. Prior to this class, did you know about these patients' rights?
No, sir, I was not this aware of patients' rights.
Beautiful. Now you know. You have been empowered. Do you understand? The only thing, in fact, I'm inviting all of you. We usually have volunteers from students. We have had a few though. So any of you who is interested in volunteering for us can join what we are doing. Basically, our mission is to get this thing out there. Sensitize patients, sensitize patients, sensitize patients. So in doing that, patients will know their rights, one.
patients will know that they can, how to enforce these rights, where to go to enforce these rights. The challenge, you know, those few doctors, not all, the doctors who have been engaging in medical malpractice or medical negligence and getting away with it, they ride on the ignorance of the patients. Do you understand? The patient doesn't know his or her right, and that's the only reason. You can't try this in America. Medical negligence, medical malpractice is a big issue. But the few cases in Nigeria that people have, there are cases that people have enforced their rights and they got judgment. There was a case of a man, a woman, pregnant woman, who went to hospital in the Federal Medical Center in Ebonyi State. Do you understand? Sorry, it's not a medical, a federal medical teaching hospital in Ebonyi State. And when she went to the hospital for delivery, the doctor was not around. The doctor on call that's supposed to take that delivery was not around. They called doctor on phone. That's nurses called doctor on phone. Doctor didn't pick. They sent text messages. He did not respond. He didn't come. The nurses were delaying to attend. The lady was taken to the hospital by her father. There's not, discharge us, let us go to another hospital to come. Doctor is not coming. The baby, labor has started. By the time the nurses reluctantly went to attend to the woman, she gave birth to a dead child. They sued. And they got a judgment of 50 million against the hospital. Do you understand it? Now, the checks and balance is that people are suing hospitals, and the media is reporting. It's a collective effort. If we have sufficient media reportage of successful cases of medical negligence that went to court or either medical and dental council, and the patient or victim was successful, now that is sending a message to the hospital that patients are no longer sleeping. In fact, my slogan when I teach medicine is the patients are coming, meaning the patients are getting awoken, the patients are beginning to know their rights, and they are coming to enforce these rights. So the only solution is the patients knowing their rights. That's all. Thank you very much. So any other question, please?
I actually have a second question, sir.
Please ask it.
Okay, sir. My other question I want to ask is, who has the right to send away a patient? Because I've heard of a situation where
Who has the right to
send away a patient from the hospital, because in a situation where the doctor has the necessary skill and expertise to treat a patient, but then the management is looking at the financial aspect and seeing that the patient may not be able to pay for treatment. So on that ground, they want the patient to leave. So in that situation, who exactly has the exclusive right to send away a patient?
Nobody has a right to send away a patient. Under no circumstance should the hospital send a patient away. Section 20 of the National Health Act says that hospital should not deny patients treatment in emergency situation. If that case is emergency, the hospital is bound to treat the patient. Now, understand that it is not free treatment. We must always draw this line. The patient does not have a right to free medical treatment. What the patient has a right to is treatment in emergency situation. Save the life of the patient will pay his or her bill. Now, we have talked about patients' rights. We've not talked about patients' obligation, primary of which is to pay your bill. Hospitals are not charity organizations. Hospitals are run and maintained with money. Do you understand it? Now, beyond the doctors, beyond the nurses, there are other non-medical staff. There is the cleaner there. There are porters in the hospital. You have people in the accounting section. You have the security personnel. All these people are paid with money. The hospital equipment are purchased with money. Diesel, the running cost of hospital is money. So we do not, in advocating for patients' rights, undermine the right of the hospital or the obligation of the patient to the hospital. Another obligation of a patient to the hospital is to take his or her medication as prescribed by the hospital. To take his or her medication religiously as prescribed by the hospital. Another right, another obligation of the patient to the hospital is to give accurate and truthful information to the hospital, to the healthcare provider. Now, you see what we do in Nigeria, falsification of documents. Somebody will say is football age. Hospitals, they work with information. If you are 50 years old and you come to hospital and say you're 34 years old, the hospital will treat you as a 34-year-old person. Now, the drugs and medication that we give you, medications, they have age range they work with. So instead of giving you 50 years old patient's medication, they'll be giving you 34 years old patient medication. Now, if there are complications, would you hold the hospital liable? If they found out that you gave them false information and that is what is leading to the complication you have, the hospital will be exonerated. So the patient has the right or the obligation of giving the hospital accurate information about his person. Some ladies would have had 3, 4, 5, 6 abortions. Some men smoke, they drink. They will come and tell the hospital they don't smoke, they don't drink. These things have side effects on you. Do you understand it? So at no point should the hospital, no hospital has the right to send a patient away. There have been cases where hospital detain patients. In fact, we intervened in one in Lagos State where a hospital detained a woman and her newborn baby for 3 weeks because of 70,000 naira. The woman the hospital delivered the baby and they charged the woman 200,000. She paid 130 and had balance of 70,000 to pay, and the hospital detained her and her newborn baby. When the case got to us, we called the doctor and said, "Okay, you can't turn a newborn baby to a prisoner." So they had to release that child and the mother. Now, are we saying patients should go to hospital, receive treatment, and run away? No. There are legal means of debt recovery. There is a legal procedure of collecting your money from a patient. So you cannot detain the patient. You cannot also discontinue treatment because a patient can no longer pay his or her medical bill. Does that answer your question?
Yes, sir.
Hello,
It does, sir.
Okay.
Hello, sir.
Awesome.
Yes, sir. It does, sir. I also want to ask, based on what you just said, you said the hospital does not have a right to discontinue treatment just because the patient cannot pay. Hello,
Yes.
sir.
I'm with you.
Okay, sir, but in a situation whereby it's a continuous treatment that is ongoing in batches, and maybe what if like they inform the patient that okay, this treatment that you're undergoing, you have to pay for it as it goes, because in that situation, the hospital will be at a continuous loss if the patient cannot continue payment for their treatment. So how would they
Okay, let me move further a little. Section 11 of the National Health Act provides for basic healthcare provision funds. We talked about it last week. 5% of that fund is to be made available to hospitals for emergency situation. Now, remember, the hospital, the Section 20 has said nobody should reject a patient to deny patient treatment for any reason in an emergency situation. Now, Section 11 makes provision for basic healthcare provision fund. Now, that it tabulates how the funds will be expended. 5% of that fund is to be given as subvention to hospitals so that they can cushion the effects of what you're saying now.
Do you understand it?
Yes, sir.
Hello. Now, that is on paper, but it is when we begin to push for implementation, and not diversion. So I think under 2022, the Minister of Health said he used that fund to buy ambulance. Now, ambulance can serve as emergency, but not for patients' emergency within the hospital setting. Do you understand it? Okay. So
Yes,
there's
sir.
always a way. There are people who come, there are charitable organizations who come to hospitals once in a while to take care of the indigent patients who cannot pay their bill. The hospital know them. We have also participated. We have gone to what's it called, Garki Hospital, to pay the bills of patients. In fact, the person who coordinated it flew in from US and called me and a few other persons. I said, okay, can we go to Garki Hospital? I made the arrangements. Before his arrival, I was going to Garki Hospital, asked nurses, they know them. Can you give us patients who are indigent, whose bill they cannot pay? And we got a number of them, and we paid part of their bill. We spread the money. Okay, pay like 50% of this person's bill, pay like 30% of this person's bill, so that people can benefit. We spread the money. The hospital also have their own, would I call it corporate social responsibility, of finding a way of writing off some bills, the ones they can. Do you understand? But
Yes,
you
sir.
cannot, because you want to enforce your rights, now go against the law. So that is it.
Okay, sir.
Okay.
Thank you, sir.
Thank you very much. We have to draw this meeting or this session to a close. There's another session that will be starting very shortly. So we'll just quickly take a picture, right, so that we can be done with this session. Thank you so much, Mr. Ebenezer, for your time and your shared knowledge. This class has been truly informative, and I'm sure our mentees hold the same view. So please, I would like to ask our mentees to kindly turn on their videos so that we can quickly take pictures and then draw the session to a close. Okay, please, can we kindly do that so that we can run through that very quickly?
Some people's videos are not on.
Okay, please, can we have more compliance from our mentee? Thank you. Grace of God, Oluwa, Juwonli. Yes, please, thank you. Thank you very much. All right. I think we're done with that. Thank you so much for joining in for today's session. Thank you to the people who presented for their different groups. A job well done to all of you. And we want to say thank you again to Mr. Ebenezer for sharing your time, sharing your experience with us. We look forward to having you in our subsequent class. Thank you, sir, for always answering the call. May God continue to bless you, sir. And I wish everyone a wonderful evening ahead.
Thank you.
You all enjoy
Thank
a
you very
wonderful.
much.
Thank you, sir. And bye bye,
So
everyone.
goodbye.